I'm Dr. Allison McKay. I am the co-owner of the Physical Therapy Effect and the director of the Pelvic Health Program. So today we're going to go over a little bit about what to expect for your first time coming in to see us. Please arrive 15 to 20 minutes early before your appointment to allow for time to check in, as well as to complete any paperwork you may not have had the chance to do ahead of your visit. Once that is all completed, you and your therapist will then go upstairs to the private treatment room. You do have the ability to bring an additional person if that would make you feel more comfortable, but is not always necessary. Next, once you and your therapist are in the room, you two will discuss any sort of relevant medical history regarding your condition coming in to see us, and any of your concerns going into the visit. After that portion, we will then give you an overview of what to expect for the rest of the assessment. We may use models such as this, as well as additional ones in the office, and explain to you from beginning to end what we're going to look at, everything including your spine, hips, strength, what your breathing mechanics might look like, and then we'll go into what the actual pelvic floor assessment will look like. It will include both an external assessment of the genital region, as well as an internal assessment of the pelvic floor muscles, which can either be transvaginal or transrectal. The reason behind doing any sort of an internal assessment is so that we can get a better understanding of how those muscles are functioning, what their strength is like, what your endurance is like, and if we can reproduce any of the symptoms that might be bringing you in today. At any point during the assessment, if you become too uncomfortable, if there's too much pain, or you've just decided you kind of want to pause there for today, you have the ability to stop at any point in time. You do also have the option, before we even do the internal assessment, of keeping that and saving that for an additional visit if you want to just go over the external aspects of the pelvic floor condition and save the internal portion until a further date. Once the internal or external assessment is completed, then you and your therapist will come up with a plan of care going forward and let you know what treatments are going to then look like. Depending on time for the first session, we might be able to send you home with additional things to work on before your next visit. Those could include postural modifications, some exercises and or stretches, as well as potentially completing a symptom diary for you to go over at your next follow-up visit. At any point after your session, you have the ability to contact us via email or phone call if any questions might arise, or you can always write them down on a piece of paper and bring it with you for your next visit. Generally, we like to see people about once a week for the first couple of weeks to get into a good plan, but again, that's something that you and your therapist will discuss at the end of your session. We look forward to seeing you here at the Physical Therapy Effect. Please feel free to contact us with any questions or concerns you might have after watching this video via email or a phone call.